Eye movement desensitization and reprocessing, EMDR, is a structured psychotherapy or talk therapy for PTSD. EMDR can help you process upsetting memories, thoughts, and feelings related to the trauma. By processing these experiences, you can get relief from PTSD symptoms. The idea behind EMDR is those traumatic memories, when unprocessed, can become stuck in the brain, leading to a wide array of emotional and psychological difficulties. After trauma, people with PTSD often have trouble making sense of what happened to them. EMDR helps you process the trauma, which can allow you to start to heal. In EMDR, you will pay attention to a back and forth movement or sound while you call to mind the upsetting memory until shifts occur in the way that you experience that memory, and more information from the past is processed. The brain is always trying to solve problems. For example, a Marine who did multiple tours in high conflict zones may ask themselves, all of my friends got blown up, why am I still alive? This is the kind of question the mind will insist be answered. The brain will keep going back to the event, but if it can't find an answer or accept the answer, the brain will not abandon the search if the question is considered important enough. The brain will keep coming back to it, and this can result in recurrent dreams, intrusive memories, and flashbacks. When we rely on the brain's natural capacity to heal and process traumatic experiences, the EMDR addresses the persistent PTSD that you are experiencing. During the EMDR session, the therapist guides you through a series of standardized procedures designed to stimulate activity in both sides of the brain, right and left. This type of stimulation is achieved with side-to-side movement of the eyes. At times, other techniques are used, such as alternating sounds or taps. Sometimes patients will present to care knowing exactly what the triggering event is. Sometimes patients arrive with generalized symptoms, such as trouble sleeping, getting irritable for no reason, or crying for reasons that they don't understand. Therapists can help you figure out the why through EMDR. EMDR therapy focuses directly on the memories versus altering emotions, thoughts, and responses surrounding the trauma. EMDR is intended to change the way the memory is stored in the brain, thus reducing and eliminating the symptoms that are bothering you. Since the trauma itself is over, EMDR brings back the trauma of the memory and applies techniques to allow the brain to bring in additional information that the patient knows. For example, the fact that you are safe now, that you survived, and that you are no longer in a state of danger. It can also include facts, such as the event was not your fault, and you are not to blame for what happened to you, for example, being raped or assaulted. EMDR is time-limited and designed to help patients heal from trauma in a relatively short amount of time. It is important that you know that strong emotions may come up during the therapy, such as grief, anger, anxiety, and fear as you face the memory. As more information gets added to your memories, the distress will start to come down. The therapist is trained to notice the changes in your body as you go through the sessions, and they will check in with patients regularly and will ask you to report back to them on your experiences. You may notice that you feel more tired or that you're experiencing more vivid dreams following the reprocessing sessions. It is normal to experience these things as they decrease the avoidance and begin approaching the trauma and facing it head-on. EMDR helps those who have experienced recent trauma, and it can also help patients who have carried the weight of traumatic memories for years. For a single disturbing event or memory, it usually takes between 3 and 6 sessions. More complex or longer-term traumas may take 8 to 12 sessions, or sometimes more. Sessions usually last between an hour and 90 minutes. Is this something that you're interested in trying?